Mental health doesn't work in a vacuum. Our facilities at Grand River are closely linked with families and community partners.
In order to run effectively, the mental health program requires strong community partnerships and partnerships with committees such as the FACE group. FACE group represents our patients and our family members who've received treatment here at Grand River Hospital. So it's really important that we don't operate in a silo and we consider a great number of perspectives as we make decisions and plan and move forward as a program.
The family perspective in mental health and addictions programming is one that brings the experience of the individual, and also I think the increasing importance of that perspective has to do with the fact that the individual is going to go back to the care of the family, and the family would be able to give that perspective to help the hospital prepare them for giving that care after the individual leaves the hospital.
Our work is about preventing kidney disease altogether, but also providing the right type of care depending on our patients' needs.
There is an exciting evolution that's occurring in renal services, which is looking at how patients could be at home for their care. That includes dialysis modalities such as peritoneal dialysis or home hemodialysis. I think for a long time either people didn't know it was an option or didn't have the resources in place, and now we're trying to address both those issues by broadening people's awareness when they come to the clinic that you may never have to be a dialysis patient in the hospital. You may be able to go straight from the clinic straight to your home.
Grand River Hospital's renal program works closely with patients to help make their experience better. A council within the renal program helps connect patients and care providers to give advice and offer input.
The Renal Council has been very rewarding for me personally because we've been able to see different light as to how the hospital works, and at the same time I've been an advocate on behalf of the patient, and we've been able to set policies and change policies and really make some real difference here at the hospital.
Our complex care and rehabilitation programs help provide care for patients who have ongoing health needs.
Our programs are really designed primarily to help people to support their recovery and return home back to the community. There are a smaller number of patients who do stay with us for longer periods of time. And some individuals come and participate in the program, but then do go on to another kind of care setting out in the community. We have the opportunity to introduce 10 new restorative care beds, and these beds are an opportunity for adults who are 55 years of age and older who have recently been in the hospital to come into the program for a short period of time to convalesce, to maximize their independence before they return home to the community.
The thing that I'm proud of the most working here at Grand River Hospital is working with professionals from a variety of disciplines who are committed to providing compassionate, very humane care to patients with neurological conditions and behavioral challenges. The risk for burnout is really great working with people with behavioral challenges for one reason or another, and I'm always amazed at the power of communication and teamwork to manage to make this sort of environment actually a pleasure to work in.
At Grand River, we're taking X-ray to a new high-tech level.
Over the last year, we've upgraded our equipment from computed radiography to digital direct radiography. That radiography includes lower the dose to the patient, faster gaining of the images. We can have a faster patient put-through time. The images are higher resolution, more detail, therefore their diagnosis will be easier for the radiologist because more information is obtained.
Grand River has a new Award of Excellence for employees and physicians. Ruth Morrison, a patient porter in medical imaging, was the first recipient of the award for her dedication and hard work.
To break the ice with patients when you first meet them, communication is a big thing. Just being yourself, being friendly, honest, open, and trying to answer any questions that they have or fears, and just, you're a normal everyday person. You're a mother, you're a friend, brother, sister, and I think when they feel you and you feel your sincerity, it helps.
With their new automated plate streaker, the microbiology lab has upgraded equipment to improve the quality of testing.
Before, the plates were streaked by hand by a technical assistant. By purchasing the plate streaker, this machine does that for us, so it frees up the hands of the technical assistant so they can process other samples. It provides consistency in the way the plates are streaked, and it allows the technologist to know that each plate is streaked the same, and it allows us to pick out the pathogens to work on.
Upgraded technology in our pharmacy services program is improving patient safety.
The upgrade involved improving the record that we use that would more effectively help us document medications that are given to our patients in the hospital. The benefits for patient care are a stronger medication record, which helps reduce the risk of medication errors and ultimately results in better patient care.
We're also pleased to provide expert health advice to patients through our retail pharmacy. It's in the front lobby of the hospital's KW site. At Grand River, we're fortunate to benefit from the services of nearly 800 volunteers at our sites. Our hospital is a richer place thanks to their hard work and dedication. Another significant partner is the Grand River Hospital Foundation. It helps raise money supporting new equipment and renovations that improve patient care.
A lot of programs in our hospital benefit from donor dollars. Some examples are our surgery receive equipment through donor dollars. There's also MRI upgrades that were recently done through donor dollars. And also we've had a very generous donation from the Cavalman Fawn Foundation to bring 2 new NICU beds to our NICU program, and with those donor dollars have equipped those beds.
The efforts of the Grand River Hospital Foundation would not be possible and would not be as successful as they are without the great efforts of our Hospital Foundation Board of Directors, several committees that contribute to the Board of Directors and their work, and also the volunteers and the time and effort that they spent in giving of themselves to the Grand River Hospital Foundation is priceless.
In coming years, we will continue to pursue excellence in each of our clinical programs and also attract and retain care providers to support our community's health needs. As you can see, Grand River Hospital is doing a great deal to provide exceptional care with compassion. Grand River Hospital is looking forward to providing a range of specialized services to patients in the years to come in partnership with other health providers and with the strong support of our community.